So tell me why you're here.
I want to see if I can fix the headaches that I've been dealing with.
Okay.
Yeah,
How long has that been going on?
for 4 years.
And you had braces just prior to the headaches, right?
Yes, I removed them 7 years ago, I believe, 6 to 7 years ago.
Okay.
Yeah.
And before the braces, the orthodontic work, you never had a problem?
No. No.
Okay. Who have you seen for the headache problem since it's started?
I already, first, I was having a lot of, like in here, I was pointing the headaches all around my face here.
Okay.
So I did my general doctor first.
Right.
Then he referred me to sinus specialist, thinking might be a sinus.
Yes.
Well, they did said that my sinus was inflamed, but it was because of the tension and the headache that I was having.
Okay.
And it was not a sinus infection or problem.
Okay.
Then I went to see, they referred me to a neurologist.
Okay.
And I've been seeing him for a year, I would say a year already. He already changed 3 treatments. And he said if it doesn't work, I have to see another specialist.
Okay.
And he was thinking more a psychiatrist with a higher medication.
Okay.
Because the headache doesn't want to go away. I
So-
wake up with a headache and I go to sleep with a headache.
Okay. You said you had tension in your face. Can you point to where the tension
Yeah,
is?
the tension is here, and I notice when the headache is very intense, it's like in the back of my ears, and all the way in the back, like upper neck, and also constantly I feel the need of popping my neck and tension in my upper back,
Okay.
and obviously all here, but it's more I say it here.
So the headache, would you say it's around the temples, the eyes?
Yeah, when it's very intense, my eyes are very sensitive, and they start tearing, like a lot of see, very sensitive in this, especially in this area. That's what I feel, the sensitivity.
Okay.
And they start crying. Yeah.
Does it ever wrap to the back of your head?
Yes, here.
Does that happen first, or at first does it happen towards the temple?
Oh,
I know that's kind of hard to...
It is hard because I've been dealing with this for many years, and it's hard to say where. Since I read about the TMJ, I've been trying to pay more attention where it start, and I wanted to say they do start like in here in the back,
Okay.
and then all over. Now it hurts just to with my hair. It's just so I feel that it's all over. Then just brushing hurts.
Okay.
So it is hard to point where it starts now, but I think it is here in this area.
Okay. And one last question. Cold and hot. When you're drinking or eating something cold, do you have a problem with that?
No.
Not in particular?
No. Just when I bite things that are hard,
Yes.
I do feel this side is more sensitive
On
to
the right.
bite. Yeah. And if I'm eating like steak, I have to always bite in the other side.
On the left.
And also, I feel immediately very fatigued. Talking a lot also fatigue me. It's just like I feel exhausted. Yeah.
Okay. Thank you very much. Here we go for real. Bite home really hard. Now rake off to the right and open. Thank you. Okay, you can kind of see See the way you're skewed off to the right back?
Mm-hmm.
You should be more centered. I mean, you have a full complement of teeth. Everything is very right-sided. Remember you mentioned to me that you were sensitive, especially on the right side?
Mm-hmm.
Yeah, that's consistent with what I see right here. You know, here you are clenching. You see the way this little kite, this little diamond is just kind of sitting there, sitting there. Now here you're trying to swing off to the side. And you're rubbing on this back tooth way back here. It doesn't belong. That's not what's supposed to happen. What's supposed to happen is that kite is supposed to shoot up towards this area, towards your eye tooth, your canine, which is up here. And you're not doing that. So we need to change that. In addition, this number, see the way it's yellow and it's red? This measures the amount of time it takes your teeth to kind of, once they first start hitting, to come all the way together. It's taking too long, which means the muscle has to work harder to make it happen. And then this one right here that's red is the amount of time it takes your back teeth to separate, and it's way too long. It's about a factor of 5 off. So now, T-scan, please. Let's practice. Bite home, and now rake towards me. Good, the left side. So we're going to go home, we're going to clench, we're going to rake to me, and we're going to open, okay? All right, you're doing great. This isn't hurting, is it?
No.
Good. Don't close yet. All right, bite home hard, rake to me, and open. Thank you. Pretty consistent. You're still way right-sided, which is what we saw earlier. And you're trying to go to the left, and look what's happening. This right side's fouling you up, and then you're rubbing towards the back wisdom tooth. It should be shooting towards your left canine, which is up here, number 11, and it's not. It's doing the opposite. Okay, first thing we're going to do is bond her to canines.
Okay.
I mean, there's way too much friction back there to start messing with. See, we subtract or we add. In your case, I want to add from the get-go because I want to affect a faster separation.
Don't let me hit
Does that
you,
make sense?
sorry.
Yeah.
So you want your canine to do its job better. It's not doing a good job because of where they moved it orthodontically.
Still flatter.
Yes, please. For me, please. And now bite down. Is this still sore way back here?
A little.
Is it like it was in the beginning?
No.
Better already, isn't it?
Yeah.
Open for me. How about this side?
It's still sore.
Still sore, just like in the beginning?
No.
A little better?
Yeah.
Okay. You're already feeling a difference, aren't you?
Yeah.
And we haven't even touched the back yet. So now we have to do it as subtractive. We're going to start working that back.
Oh boy.
It's just going to be water. Feel sensitive? Normal. That's normal, because we're just starting. Remember? Well, you don't know this yet, but when teeth are hitting too hard, when they're being hit too hard, they're going to be hypersensitive. And then as I start taking the load off of them, they're not going to be so sensitive anymore, okay? So that's totally normal. See, your wisdom tooth is your scourge. It's still whacking and rubbing on that wisdom tooth. I removed the one that was in front of it, and now this one's showing up. It's like I'm peeling back layers of an onion. And then, I'm trying to find one concentric layer, and then all of a sudden more glitches. But eventually we'll get to the point where we're all on the same layer, if that makes sense.
Yeah.
Okay. Here. What's it feel like?
I feel that I'm able to touch more spots, like when I close my mouth.
Feels a little more relaxed yet?
Yes, I think a little bit. I don't know if it's because it was open and then feels good to be just
closed? Sure. Let me check something. I'm going to check your pterygoid muscle again. Is this?
Feel tender, but not too much.
Not that much at all, though, right? Okay. How about back here? Not too bad?
No.
Good. Good. Catch your breath. Okay, open for me. Close down. Is that better? Is it gone?
No, it's still sore with that. Better.
Would you say it's 50, 60, 70% better, 80?
I think like 70% better.
Okay, than the beginning, right?
Yeah.
Okay. Open, please. How about this side?
Oh, that one is like maybe 90% better.
You're almost done, right? Good. Excellent. We're getting there. See, all the muscles communicate with one another. When one has to really brace a lot, the ones around it have to brace a lot. So the fact that this is releasing, and I'm also objectively seeing that your others are releasing, this is a good thing. Kind of makes sense, doesn't it?
Yes.
Does it feel different yet? Hard to tell still,
Hard
huh?
to tell, yeah.
Okay, that's all right. Okay. Right home. Good. Open for me. Relax. What do you think?
Oh, getting better now.
It's really getting better now, isn't it? Did that make a big difference, what I just did on the front there?
Yeah.
You said 70% about 2 minutes ago. What is it now?
80.
80? Okay. That's all right. And how's this bad boy? Is he almost gone, or
The same.
about the same as last minute ago? So he's about 90% better? Okay. We're probably about, I'd say 80% done, by the way, just to give you an idea, okay? Okay. Now we're getting down to it. See the way it's bouncing back and forth? This left side, that's shooting to the wisdom tooth on the opposite side. When you swing right, the wisdom teeth here are slowing the muscle down. So the muscle has to pull it over that mountain before it can shoot where it needs to go. But compared to when you walked in here, 30 minutes ago, before we started this, it's already, we're close to there. Okay. Let's see something. Close down. What's it like?
Better.
80, 90, what do you think?
80.
80? What out here?
Yeah.
He's about gone, isn't he?
It's still, I feel it, but it's not like
Almost nothing?
almost nothing. Yeah. I just feel a little bit more sore than sensitive, like one area.
Right. That's okay. Hard. He's releasing a rake to me. And okay. See, so everyone that's ever adjusted your bike before, they've just used paper marks, and they're not always right.
Definitely. Much better.
Much better, right? Okay. How about back here?
It's still the same.
But it's...
It is not like you touch it. I feel that it's tender, but not painful when you touch it.
And the right side, in contrast, what does that feel like?
I think it's like 90 compared to what it was. Still, I feel that it's tender, but it's not so much anymore.
Are they about the same now?
Yes.
The left and the right? Yeah. Go ahead and clench for me. Just bite together. Does it feel different when you clench? Does it feel comfortable?
It feels comfortable, yeah.
Headache to disappear today. Expect it, if it's primary, if the bite was the reason and the muscle for the headache, by Monday you should walk in here and it'll be like, you know what? It's better. I can't say it's completely gone, but it's better. So then you'll call me a month or two from now and you'll be like, it's gone.
Okay.
That's what I expect, okay? It's not necessarily this big miracle that happens instantaneously, but relaxing face and all that, that's normal. You see what I'm saying? But it takes time for you to clear that excess lactic acid, remember? The stuff I was talking about? And that takes, everyone's a little different. Some people a week, some people a month. Usually it's by a month. Some people that moment, but you've been dealing with this for years. You've got a lot of that stuff floating around.
And it's a daily thing, it's not
it's
like
constant,
once in a while.
right? Yeah, so...
I just noticed that the headache that was here is not there. So I feel definitely better.
So right now, your face feels relaxed?
Yes.
Is that a fair statement?
Yes.
You told me something about you're yawning now.
Yes.
Tell me about that.
I didn't realize I was not doing it until that I think it was Saturday that I was telling my husband, oh my God, I was exhausted. I think I was exhausted, yes, and I did sleep well. Yeah. But I was feeling like, I'm doing it. I'm able to open my mouth, and I didn't realize that I was not doing it.
Yeah. So you can chew better, is that fair?
Yes, I was a little bit sensitive in one side.
Yeah.
In the other side, until you fix it, I think it feels a little bit...
Yeah, but comparatively, you're less sensitive...
To crunchy foods.
sure,
Yes,
right?
for sure. Yes.
Yeah, and the cold, it's a little less sensitive than it was Friday?
Yes, it is not sensitive. I just feel the cold water, but it's not bothering me.
Not
No,
terrible.
no.
Okay, sounds great. Thank you. Lean back for me. And open and close. Is that not bad?
Not bad. It is not comfortable, but it's not bad like it was.
Not like it was Friday, for
Yeah.
sure, right? How about this side?
Better.
Compared to
Not
Friday?
comfortable? No, compared
Yeah.
to Friday, no. It's not like Friday. No.
Okay. Your face? Remember when you first came in Friday, you were going on about how there was so much tension and pain here?
Yeah, if I touch it, like before I used to touch this to feel relaxed. Now I feel if I touch it, it hurts because it's been like so many massages. That's how I feel. The tension is not,
Yeah.
I feel that it needs to heal so much touching and so much massage.
So now it's just bruised.
Yes, that's
Feels
how I
bruised
feel.
before it felt
It
tense.
yeah, I feel tense. So if I did this, it feels a little bit better when I was
Now
massaging.
you no longer have the need to massage it?
Yeah.
Is that what I'm hearing?
Yes.
Awesome. Okay. Great. How about your neck and all that? Is it feeling different?
The neck feels definitely better. It's not popping the way it was.
Yeah.
I still need to move it. Definitely if I massage it, feels better, but it's not constantly popping
Awesome.
how it was. I needed to constantly move into to make sure it pops so it feels relaxed.
Okay.
Yeah.
Excellent. And what about down here?
It feels better. It feels relaxed.
So that's the one word, isn't it? Relaxed?
Relaxed.
That's a good word for
Yeah.
the whole process?
Yeah,
What
I
you
feel the
experienced?
whole, like the headache is not, because I now that the headache is not so intense, I can see that this was causing a lot of the headache because it was tense here. And I needed even to do this to feel that I can relax this area.
Okay.
Yeah.
Excellent. So it sounds like it helped a bunch. And on a scale of 1 to 10, or 0 to 10, your sensitivity, today you're saying it's about a 1.
Yes.
Hoy está frío afuera.
And then the muscles, those questions, you're not... Friday, everything was filled up in here. And today it's totally different, isn't it?
Yes.